Hi everyone, my name is Dr.Temjennungsang. I'm a dental surgeon by profession. I practice at dental touch and facial aesthetic at Nagaland with special focus on orthodontics, dentofacial aesthetics and restorative advanced aesthetics. I want to thank the Dimapur Ao Baptist Youth Ministry for giving me this platform to share and speak on substance abuse and oral health. So friends, today I'll be sharing some of my clinical experiences and cases on tobacco use. So to start with, firstly, I would want you to imagine when you were born. From the very first breath you take, your very first word, your very first of worldly experiences like food and drink, your loudest scream, you rely on your mouth, right? So every day we use our mouth to form different agendas, to raise our voices, to sing comforting lullabies to the baby, to share love with kisses, to share kindness with a smile. Isn't that wonderful that our mouth does all these things? We have been so blessed. We should be happy and proud of it. Unfortunately, many of our people use their mouth in a very unhealthy, risky behavior, damaging their oral health, its structures, its functions, and its aesthetics, resulting in diminished self-esteem and negative social relationship. And all this brings sufferings and pain to the body and to the mind, a huge financial burden to the family, complicated treatments and surgeries resulting in facial deformity and disfigurement, physical handicap, and mostly ultimate death for many of them. Let's see around the world what is happening. Globally, tobacco kills 80 lakhs people in a year. 80 lakhs is such a huge number. And 80 lakhs is 4 times the population of Nagaland, just imagine. More than 10 lakhs death is the result of people not smoking but being exposed to secondhand smoke. While in India, every 8 seconds. So if I have to count this 8 seconds, it's just like 1, 2, 3, 4, 5, 6, 7, 8. Somebody just died as I've started counting. Every 8 seconds, somebody died because of tobacco use in India. In Nagaland, Global Youth Tobacco Survey, they did a survey on the age group of school children between 13 and 15. And they found out 35% of the school students use smokeless tobacco. 35% of school students. That's really a threatening number. And this makes Nagaland the highest consumer of non-tobacco, smokeless tobacco in India. So what are these smokeless tobacco? These are the gutkhas, the pan masalas, the pan, the raja, and all other forms of tobacco that is used in smokeless form. So I would just want everyone, friends, I just want to be informed that, I just want you to be informed that tobacco kills half of its user. More and more these days, people are coming into the clinic complaining that they have been increasingly finding it unable to open their mouth. All of this patient had a soreness in their mouth and constant burning in the oral cavity. Some has nasal voice and find that they cannot blow their cheek like this. Some cannot extend their tongue out. And some, they find it complaints of difficulty in swallowing. All these patients are suffering from oral submucous fibrosis. And what is this oral submucous fibrosis? It is a precancerous condition And if these patients do not stop taking tobacco at this stage, this will lead to cancer in a very short time. So it is a warning sign to the patients. And in my clinic, those who come with these conditions are at the age group of mostly 20 to 35 years of age. And also some as young as 14, 15 years old, school children also comes. I wanted to share some of my clinical cases. These patients came to my clinic complaining of difficulty in eating, and he said he cannot open his mouth, and when he eats anything, it burns his mouth. So on examination, I found that there were white patches. These are called leukoplakia. These are white lesions, precancerous lesions. And when I touch the soft palate, these are fully fibrous, cannot open the mouth, that's the reason. And it burns anything he eats. So we started the treatment, and he had stopped completely the use of tobacco. Now he's improving it. So this is one of the precancerous condition lesions. And he had been taking this tobacco, this gutka, shaker, 10 to 15 packets in a day, and for the last 5-6 years. This is one of the cases that he survived. I want to show another case. Okay, here is another patient. He is 50 years old. He came to my practice saying that he finds it difficult to eat. He cannot chew the food properly. And he also says that he does not like the aesthetic of his mouth. So when I examined his mouth, I found that the whole lower jaw has been completely eroded. It has gone down. So that's the reason he cannot eat. And on taking any food or juice, it burns. It is so sensitive and it's painful. And so when I consulted him further, he said that he had been taking this Rajnikanda, the pan masala, the big packet, 1 packet in a day, and he had been taking it for the last 6 years. So now he had completely stopped taking this pan masala, and we have completed with the upper jaw. Now we are getting ready to do the lower jaw, the full mouth rehabilitation, and it really costs a huge amount of money. I also want to share one of the cases that this patient came with her mom, and this mom came and told me that, Dr. Temjennungsang, my daughter cannot eat anything, she is in pain, and mostly above all, she doesn't go anywhere, she only stays at home. Can you just help her with her problems? So when I asked and checked her, examined her oral health, we found this was her condition. We found that she had lost a lot of root stumps, the tooth were fallen off, and the gums were swollen. It was full of abscess. The tooth were really shaky. It was a bleeding gum. It has a bad grit. And all this few teeth that he has it now, she has it, were so mobile, it was just shaky. I told her mom that, Auntie, I'm so sorry. At this stage of time, I would find it really difficult to treat her because all her teeth are in very bad conditions. This will slowly fall off by itself in 1 to 2 years. Once that falls off, then I can be of help to her. I can make her artificial teeth, the dangers which the elder people wears it, but she had to remove at night time, and again in the morning she had to clean it and wear it. I feel very sad for this lady because she was just 25 years old and she was not even married, and she had to go through this of wearing the danger what the elder people wears it. So this was the condition which we had come across in our clinic. This patient, again, he came to our practice. He had been chewing this pan tamul and biri cigarette for a long time. And when we examined it, we found that he had an oral cancer. So through the biopsy, we could know that this is an oral cancer, squamous cell carcinoma, and I referred him to an institute where surgery could be done. In a year time, I was told that this patient passed away. I also want to share this patient. He came to me. He had a surgery before for his cancer, oral cancer. So that's how you see there's a big hole here. The half of the jaw, upper jaw has been removed. That's how you can see the inside as he opens the mouth. And he said, Dr. Temjennungsang, I cannot eat anything because the whole mouth is burning, it's in pain. I cannot chew, my digestion has a problem because I cannot chew anything on it. And that's how I'm getting really weak. Can you help me? So we started working on building, constructing for his teeth. That's how we have gone through. I saw a lot of pain that he went through. After a few years, I learned that he passed away at the age of, at the early 30s, very unfortunately. So ultimately he died to the cancer. And this friend, he had been taking this pan and cigarette and alcohol for a good number of years that had led to this kind of conditions. So friends, if I have to give you a message today, it would be this. Tobacco is extremely addictive. Once you start, you may not be able to stop forever. And the same is true for drugs and alcohol. In conclusion, I just want to say this, friends. At the end of the day, no matter what, you will need your health. Every precious bit of it in this awesome time, today and tomorrow. So friends, stay away from this tobacco, alcohol, drugs and other risky behaviors. And if you are using it, stop it. This is the best time to stop it. Make a responsible choice today. Visit the dentist, have an oral check for oral cancer, do examinations and do the other needful dental needs. And celebrate your life in smile that exudes vitality, youthfulness, confidence, and a good oral health. Thank you.